Well, good afternoon, everyone. Thank you very much. You may be seated. It's good to be back in the routine again. We've been off for a little bit, summer months, getting a little rest, but we're ready to begin the fall and the rest of the year with a lot of work uh, to be done. So, as we begin this new month and return to full work here in Washington, we are focused on a clear purpose, and that's protecting what matters most to American families. And there are a few things that matter more than the ability to get health care. You need you, you need with you know you don't need to be told that you're being crushed by the cost of health care. Today we kicked that off an effort to eliminate the not maybe eliminate the cost of healthcare, but lower the cost of healthcare by focusing on healthcare security, specifically the strength, re- reliability, and future of Medicare and Medicaid. These programs are not abstract government programs. They're a promise. Medicare is the promise that after a lifetime of work, you will not be left alone to face the high cost of doctors, hospitals, and prescription drugs in your later years. Think about that. There's been so much talk lately about eliminating Medicare subsidies and just having it where our seniors are having to pay pretty much full price for their medications. That's not right. That's not right, and that's something this administration, since day one, has been adamant about is to ensure those subsidies are continued, that are in place, and are there for our seniors. I mean, think about it. That's the last place. That's the last place I would think about even cutting in the budget would be our Medicare and Medicaid. It is one of the most successful social insurance programs in American history, and it has given millions of seniors peace of mind and dignity. Medicaid is the promise that children, people with disabilities, pregnant women, and families who hit hard times will have access to essential health services. It is a critical safety net that works in partnership with the states. Keeping those promises is one of the most basic responsibilities of government. This is not a partisan talking point. This is not Democrat versus Republican, independent. This is a practical obligation. One of the most immediate and pressing concerns for seniors is the cost of prescription drugs. Medicare Part D has helped millions of Americans afford the medicines that keep them healthy and independent. The low income subsidies, known as extra help, are especially important for people living on fixed incomes. And you've often, for those who followed me the last 4 or 5 years, you oftentimes hear me talk about a story about a teacher friend of mine back in Texas. And this does deal with healthcare subsidies and the cost of prescription drugs. Um, Again, and this goes into another um, thing we're working on, and that's teacher pay. But this teacher back in Texas was making what teachers make, not a whole lot of money. Uh, that's a whole different story, but a lot of them live just, a lot of entry level teachers live right above the poverty level. And so this teacher had an illness, and she had to go to the doctor. When she went to the doctor, she was prescribed a medication that she had to take to cure this ailment. And the cost of the prescription was $600. $600. Now, can a teacher who's barely above the poverty level afford a $600 prescription that she doesn't? It's not a prescription that she wants. It's a prescription that she needs. How is that fair? How is that fair? You know, and I see this on TV all the time, and I won't mention the type of medicine it is, but there's this medicine that's advertised on TV, and it talks about how you can get it for $30. And why can't that be the case for medicine that people need to survive, not for pleasure? You know, in spite of all this and all this going on, I've already directed the Department of Health and Human Services and the Centers for Medicare and Medicaid Services to deliver a full status report on these subsidies and to take every necessary step to ensure they continue without interruption. No senior in this country should have to choose between filling a prescription and paying for food, rent, or utilities. But our work does not stop at prescription drugs. That's a focal point, but it does not stop there. We must also remain focused on the overall sustainability and effectiveness of both Medicare and Medicaid. These programs work best when they are well managed, transparent in their cost, and relentlessly focused on results, better health outcomes for real people, not just higher spending. We will demand accountability. You have my word on this. This administration will demand accountability, support smart delivery reforms, and protect the core guarantees that families rely on. As we move through this month, and this month's theme is going to be protecting what matters, healthcare security will remain at the center of our efforts. We will work with Congress, with governors, with the dedicated public servants who run these programs every day, and the American people themselves. The measure of our success will be simply whether seniors can count on Medicare, whether vulnerable families can count on Medicaid, and whether the promise of healthcare security remains strong for the next generation. And that's another thing we're going to work on. You know, a lot of times teachers, public educators have to pay into what is called teacher retirement, and they don't pay into Social Security. They get a retirement, but I'd like to see a part of what we're trying to do, the reforms we're trying to do here. I want to see that they also pay into Social Security and get that as well. So that's something we're going to work on here in the coming months. Like I said, today we're just beginning this March. We have made progress over the past 5 years. We finally have got a housing bill passed through Congress that I signed a little bit earlier this summer that really puts a cap on and puts kind of a stranglehold on these corporations that are trying to buy up these neighborhoods. Corporations don't belong in neighborhoods. People do. But I want to thank you very much for your time, for being here this afternoon. It's great to see everybody again. Let's get to work. Thank you very much. May God bless you. May God bless the United States of America, and may you protect our troops. Thank you all very much. Thank you. Thank you.